Did you know smoking is the most important factor for occurrence of bladder cancers? Hello, I'm Dr. Aditi Agarwal, Associate Director, Radiation Oncology at Max Hospital, Saket. Today we are going to talk about urinary bladder cancers. Urinary bladder cancer is cancer that occurs from the inner lining of the urinary bladder, and the most important risk factor, as I said, is smoking, which is 3 times as compared to non-smokers. It occurs more in males. Advancing age more than 65 years is a risk factor. People involved in some industries like chemicals, leather, paint are also at an increased risk of developing this cancer. Chronic irritation or inflammation of the urinary bladder due to stones or infection is another important risk factor. Receiving radiation to the pelvis is also a risk factor. So what are the signs and symptoms? Hematuria or bleeding in urine is the earliest and the commonest symptom, which is mostly painless. It could be associated with pain in lower back. There could be burning in urine, increased frequency of urination. There could be fatigue, loss of appetite in some cases. Now, how do we investigate? All these symptoms do not mean that a person has developed bladder cancer, but we do need to rule out, and medical advice and attention is required. The most basic investigation is an ultrasound to know the status of the bladder. An X-ray of the urinary tract KUB may be required. If required, a CT scan and MRI, and then a cystoscopy, where a scope is inserted through the urethra into the urinary bladder, and the doctor examines the lining inside the urinary bladder. Here we see if there is any suspicious area, any cancerous or non-cancerous suspicious area needing further investigation in the form of biopsy. A biopsy is taken from a suspicious area to understand what this lesion is, and if it comes out to be cancerous, then further investigations would depend on that, which could include PET CT scan to complete the staging workup. Further treatment would depend on the staging. Most of the times it is maximal removal of the tumor from the bladder, and if required, a cystectomy, that is removal of the bladder with removal of lymph nodes, is needed, followed by further treatment in the form of chemotherapy or immunotherapy. In today's era and age, we have good modern radiation therapy. We can preserve the bladder in certain select cases with radiation along with chemotherapy. The key is detecting the disease early. As soon as you feel that there is something abnormal happening or any of these symptoms are happening, do consult a doctor. Stay aware, stay empowered. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.